Hi, my name is Eugenio Duarte, and I'm a psychologist and psychoanalyst practicing in Miami, Florida, and a member of the American Psychoanalytic Association. Welcome to our video series, Coping with COVID, where we answer your questions about how to deal with this global pandemic. Today we're answering a question from Dean in London, who asks, what is the best way to deal with anxiety associated with feelings of job insecurity? This is a real issue because lots of people have lost their jobs or have seen some kind of reduction in their work hours, so they've taken a hit to their income. And of course you're going to feel anxious when your basic sense of security is threatened. So there may not be anything that you can do about the anxiety per se, but you may be able to reduce the intensity of the anxiety if you're able to identify some of the factors that are contributing to that intensity. Sometimes we feel certain emotions more intensely than we need to, or more intensely than the current situation calls for, because the intensity is based not just on the reality of what's going on in the moment, but because also the current situation reminds us of something that we've experienced in the past. A psychoanalyst named Donald Winnicott once said, "That which we fear the most has already happened." So if you're feeling intensely anxious about your job, ask yourself, have I been through something like this before? Some kind of loss. And it doesn't have to be just of a job. It could be the loss of a relationship, of a person, any kind of loss that totally rocked your world, that made you feel like the rug had been pulled out from underneath you. Because if so, it's quite possible that you're bringing that to the current situation so that what you're experiencing right now is more of a re-experiencing. And so that your anxiety now has a feeling of, oh no, not this again. If you're able to make that distinction, then you'll be better able to understand these feelings and understand this situation for what it is and for what it isn't. Let us know if this speaks to you, and if you have a question that you would like answered, leave it in the comments and we'll try to get to it in our next video. Take care.